I think we're very lucky in Australia that a number of key things came together in the late 1990s and the early part of this century to create the real opportunity for headspace. Big shifts in community attitudes, a big shift out of hospitals to focus on anxiety and depression in the wider community, their effects on suicide, on alcohol and drug use, on families, on the workplace. A real lift in government interest in that nationally, and then a big question arose. Do we have a health system that can actually respond to these challenges? And I think the more that people looked at the challenges and the chance to make a real difference, an essential part of the answer was missing. Have to start at the start. Have to capture young people when they're really in trouble for the first time, often at the end of school or shortly after they leave school or in their early 20s. It was a critical period with the Howard government between 2000 and eventually between 2004, of both at the prime ministerial level, at a senior policy level, in key ministers during that period and those responsible for mental health in that period, Chris Pine and Trish Worth and others, really saying, you know what, we really could do something here. This could really make a difference, and the people working with them very closely. On the other hand, I was very fortunate to be in Melbourne working with Pat McGorry and other people in the Association Beyond Blue and going, you know what, there's real community support for this and it's doable. I think the key transformational issues here were firstly the establishment of Beyond Blue, because that led to a big emphasis on changing the health system, the primary care system. The big decision then was in 2001 to start funding psychological services under what was the Better Outcomes scheme in mental health, way to better access sort of sets of schemes. That led to a kind of, you know what, we need to be looking at who uses those services. When you looked at who used those services, everybody was middle-aged still. So that was primary care. It was really good if you were 30 or older. It wasn't very good if you were younger in that particular set of areas. And I think in interactions between Beyond Blue funding of some of the work that Pat McGorry was doing and the work that Origin itself was doing, and a variety of others, I think, across the awareness sort of sector, there were critical meetings then really in 2002 and 2003 in saying this is really important. And I think we were lucky we had key people in the professions like myself and Pat McGorry, key people in ministerial offices and other areas, key people in policy areas saying, you know what, it can happen. And there is a community groundswell of support. It also politically, in a sense, became unacceptable to not be involved. And I think that's one of the key issues, and something gets really important at a community level. The political sense has to respond. I think smart politicians will and make the most of that opportunity. And we are lucky at that stage. I think we had smart politicians respond to the opportunity rather than what they've done in the past, which is run away. Oh, mental health, too hard, nothing to be done, nothing useful to be done. You know, this is the really big issue, to get beyond that and say, what do people really care about in the future? And then people say, well, their families and their kids. And you go, well, guess what? The biggest sets of problems you're going to face with your developing teenagers, the reasons they won't finish school or go to university or succeed in a trade or an employment or form good relationships themselves, are mental health and substance abuse related. And a whole lot of adults say back, yeah, I knew that. I just didn't really want to say that, but I knew it because that's really what's happening in my own life with people. So I think that's a really critical understanding, and I think at this particular period there was real connection between that focus on those sets of issues through the political leadership, through John Howard, through Mark Latham, through the ministers responsible, Chris Pine and others, and the national dialogue at that stage. The 2004 election campaign was critical because we'd never seen before both major political parties line up on a specific political issue around mental health and in a sense saying one would do better than the other. You know, that's exactly where you want to be. The issue is bipartisan, but you want an incoming government to be committed to being better than the other government, potentially, at actually doing the job. So I think there was tremendous satisfaction in that they would commit to that.